hope you're well. It is Thursday night. I'm Adam Catterall. It is a pleasure to be with you. Please welcome to the show Councillor John Leech. How are you, sir?
I'm fine, how are you?
I'm very well indeed. Great to have you back on the show. Even though we are talking about something that I'm sure we are both quite passionate about regarding the use of physical restraint against mental health patients in Manchester. And I believe that the numbers are alarming. It's getting worse.
It is. Yeah, well, basically, we carried out an audit, the Liberal Democrats carried out an audit to see what figures were like in terms of specifically in relation to face-down restraints. Figures show that there is an average of 4 restraints every day last year, which is double that of 3 years ago. And there have been 194 instances of face-down restraint in Manchester last year, which is up from only 54 in 2014-2015. And that's despite, in 2014, Norman Lamb, as a minister in the government, issuing new guidance that was aimed at reducing the need for face-down restraints in mental health trusts.
John, why is there a need for face-down restraints? Because when I hear that, it automatically sounds barbaric to me. So why would it be used at any point?
Well, I think that's really a question for the trust themselves and for the hospitals themselves. There are, in certain circumstances, they do have to restrain patients. Yeah. But there's clear evidence that for a number of reasons, the restraining patients is happening far too regularly and in some cases unnecessarily. There was a Department of Health, as I said, there was a Department of Health guidance set out in 2014 called Positive and Proactive Care, Reducing the Need for Restrictive Interventions. And it was about practical steps that could be taken, and also involving patients, family, and carers in the process to try and tackle the issues surrounding people's behaviour. But all too often there are limited staff, inexperienced staff, people off on sick and having to rely on people who perhaps don't know the patients as well as normal staff would, and so they're not necessarily able to cope fully with the patients that they're dealing with. And in the case of not enough staff being available, there are going to be circumstances where they take drastic action simply because they're understaffed.
I understand the restraint thing, but mainly for patient safety. Obviously, if somebody is hysterical and needs restraining for the safety of the person that's working there and for the patient, I'm with that. It's the face down elements of it that I don't understand as to why that is even a thing.
Well, the guidance made it very clear that staff must not deliberately restrain people in a way that impacts on their airway, breathing or circulation, such as face-down restraint on any surface, not just on the floor. So clearly the guidance was crystal clear, but I'm afraid to say it's still happening, and it's simply unacceptable. I was quite shocked by these figures, because you would have expected, given that the guidance has been in place now for 3 years, you would have expected that the number of instances would be reducing. Obviously, any more than zero is unacceptable, but the fact that they've actually increased is, I think, quite an indictment on the service.
Total abuse of power, isn't it? This is bullying.
Well, I don't know about individual cases, but clearly it is certainly very poor practice, and there may well be circumstances where, yes, bullying is the appropriate word for it, but clearly an investigation needs to take place as to why there has been an increase rather than a decrease when guidance has been sent out to hospitals about how they should be dealing with patients and making sure that the most appropriate care is available that staff are aware how to deal with patients, and that there are actually enough staff to make sure that patients are safe, and of course staff are safe. And clearly, in certain circumstances, I suspect that a number of these restraints are because either the patient themselves is not safe, or staff are not safe, and so drastic action has been taken. That's clearly unacceptable.
How far are we off an investigation?
Well, having uncovered this information, I've contacted the executive member demanding an investigation, and I would hope that swift action is to be taken now, because clearly I think when anyone sees these figures they will say this is not acceptable, something has got to be done, and something's got to be done urgently.
An independent investigation, I'm guessing, because this could quite comfortably be swept under the carpet.
Well, I think initially I'm comfortable with the executive member instigating an investigation and seeing what comes of that, because there is a role for the local authority within health and social care now to look into these issues and to make sure that appropriate action is taken. Clearly, if appropriate action isn't taken, then it would need to be taken further.
It's alarming news for families who have people that are in care because of mental illness. This is not what they want to hear, because obviously their hearts are probably torn with their loved one being in care in the first place.
It is, and you can only begin to imagine the impact that this sort of restraining of patients would actually have on the patient's mental health itself. It's clearly not going to have a positive impact on their mental health, and so more has got to be done, because people are put in hospital to get better, not to get worse. And if they're having to be physically restrained in such a way that it's likely to damage their physical health and potentially their mental health as well, this is clearly not acceptable. And anyone whose loved ones are in hospital for their own protection or to help them get well again are going to be very worried by these figures that have been uncovered.
Councillor John, thank you so much for your time, giving us information on your findings within the mental health service. So, good luck with this particular campaign, and hopefully there's an investigation.